Besides Coumadin and warfarin, a couple new agents have been coming out, which we had called NOACs or novel oral anticoagulation medications. These are going to be like the names of apixaban or rivaroxaban, otherwise known as Eliquis or Xarelto, and these have their own reversal agents. So again, patients who are on these blood thinning medications who come in with catastrophic bleeds, whether it's intracranial bleeds, bleeds around their heart, bleeds into their spine or into joint spaces, if they had penetrating trauma or blunt trauma, or if they have to go to surgery emergently, these are the patients who, when they're on blood thinners, are going to want to reverse the effects of those blood thinners. So the way apixaban and viroxaban work is they are anti-10A inhibitors. So basically 10A in the coagulation cascade is one of the last steps for coagulating blood. And what activated 10A does is it converts prothrombin into thrombin, which is factor 2 turned into factor 2A, and then that turns fibrinogen into fibrin, and that's when your clot stabilizes. So basically knocking out activated factor 10A basically prevents that last step of the clotting process. Now, there's only one new remedy or antidote that we can give for patients who are on 10A inhibitors, and that's going to be called Andexxa, also known as recombinant factor 10A. And you're basically just replacing factor 10A in these patients so that they actually have usable 10As so that their blood can clot. Now, this is a relatively new medication since a lot of the blood thinners that are 10A inhibitors are also relatively new on the market, like within the past 10 years. And so there aren't that much research done on these medications, but side effects that you want to look out for, obviously similar to Kcentra, where you're now prothrombotic. So you want to look out for stroke, PEs, DVTs. But some of the most common side effects that they've seen from this medication are actually UTIs and pneumonias. And without getting too specific into the dosing of the medication, there's basically two dosing regimens that you would do, either a high dose or a low dose. And that's going to be based off the dosing of the anticoagulation that that patient was on, as well as the last time they received that dose of their anticoagulation. So medications like Kcentra and Andexxa are pretty much life-saving medications when patients come in who are on these blood thinners who come in with catastrophic bleeds. So reversing those coagulopathies are really some of the first steps that we take to stabilize these patients.